right, so pain. So something kind of cool that I've been learning over the years. It's kind of become a little passion of mine, and Calvin knows this too. It's a little passion of mine about pain. For lots of years, pain has been kind of a mystery. It's just been something that it can ruin people's lives, and we know that. It's something that we can see an MRI, and we can see a whole lot of awful things on an MRI, and that person's in no pain. We can see an MRI that looks completely clear, and that doctor says, oh, you're clear. Everything's fine. The pain must just be in your head. And that patient hates that answer, obviously. So what have we learned so far about pain over the years? What do people think is painful? And this is what I want to attack first. So most people think that as we get injured, any kind of tissue damage will lead to pain, right? And the more damage, the more pain. What we're finding is that you can have pain without injury, and you can have no pain with a lot of injury. Why is that? We'll kind of talk about that more. Arthritis. How many patients do you have come into your door, into your clinic, and say, my doctor said I have arthritis. That's why I'm in pain, is because of arthritis. And you just say, well, then I might as well kind of dig your grave in the back, because I guess there's nothing you can do, because arthritis only gets worse and worse as we age. Sorry, right? But here's what we're finding. This guy has arthritis. We are finding that as we get older, here's the age on the bottom, as we get older, our pain actually goes down, even though arthritis is going up. I want you to start kind of seeing these principles, okay? It'll be the same principle over and over again, but I want you to begin seeing it, okay? So they took 1,200 patients who have knee pain, and they looked at them over 8 years. And what they found is as the arthritis got worse and the bone on bone got worse and worse and worse, the pain did not. Over the 8 years of that joint space becoming more narrow, the pain did not become narrow. The pain did not become worse. Okay? So another kind of pet peeve, I mentioned this before too, X-rays and MRIs. It just seems like people and patients, they kind of wear these as like a badge of honor. You should see my MRI. You should see all my disc bulge, all my herniations, all my stenosis, all my scoliosis, all my osises and itises. And they wear that as a badge of honor because that is why they're in pain. We are seeing the opposite. We are seeing, and so something kind of cool lately, what they've been doing is they've been taking MRIs of people who do not have pain, who have no low back pain in this study. And what they're finding is the exact same things that we see in people with pain. So 80% of people over 80 have disc bulge. Almost 100% of people over 80 have their discs wearing away, because that's what we do as we age, okay? These are very natural things, should not be painful. So what we used to think is abnormal, all these pictures, we see herniated discs, bulging discs, disc is wearing away and aging. We used to think all these things are signs of pain. We now know they are super normal. Very normal things of aging, okay? So now in this image, I want you to kind of tag which one has pain. These are two different images. On the left, we can see a slight bulge. On the right, we see some good herniation right there, okay? Obvious answer is this guy's in a lot of pain. Well, guess what? Both have no symptoms. And if you want to ask me about this one later, there's an article on this, okay? Both have no symptoms. So what are we seeing? So this is in relation to in the shoulder as well, knee, everything. So if you look at this chart, in red are people in pain. In green are people not in pain. And the findings are almost identical. We see all these things in people without pain all the time. Partial tears, the lesions, tendinopathy, full cuff tears even sometimes in people without pain, okay? And I'm going to go kind of quick with all these. I have a lot of content. It'll just be a rush on you of content. And so be ready, you guys. All right, in the knee, we are finding the exact same thing. We are seeing no pain people with all the same findings as people in pain. And it's just amazing. And look at this next report. Almost 100% of the people that never had pain on their MRI, we found meniscal tears. We saw cartilage abnormalities, which we know is arthritis. We saw tendonitis. We even saw some partial ACL ruptures. Okay, so what is the body doing? It's aging. It's breaking down. Spoiler alert: we are going to die. The body is going to die. It is meant to die. It is meant to show aging and wear and tear. Okay, I've used this example on some patients, and it goes well sometimes. But I tell them that all the things on their MRI, and keep in mind these are all non-trauma people MRIs, okay? And so all the things on their MRI just from life, just because they're in pain, are just natural aging signs. I tell them, I say, the wrinkles on your skin, if I came up to you and said, oh my gosh, does your skin hurt? I can see that you have wrinkles on it. Would you think I'm crazy? And they said, yes, of course, I think that you're crazy. But that's exactly what your insides are doing. And everyone's making a big hullabaloo about it. Hullabaloo is a saying. When you're active, okay, I hear this a lot too. So people that say, you know what, when I was younger, I was really active. I took a big toll on my body. I ran marathons. I did Ironman. I lifted a lot of weights, and now I'm paying for it. Quite the opposite, you guys. So people that are active in all kinds of activity, what we are seeing, running's not bad, activity's not bad. We are seeing the opposite. And so there is more wear and tear, there is more degeneration, there's more aging in people that are inactive versus active. This next one's pretty good too. So most people, and so this is a chart of people that have back pain. And this was taken over a 6-week period. And every week they were asked, which of the activities, of all these activities, led to more pain? I hope you can see this, because all of the activities of doing nothing, stress, mood, depression, the prolonged sitting, in essence, resting, doing nothing, were the most painful activities on these people with low back pain. The least painful ones were running, jogging, lifting, non-contact sports, being active. You guys, we've been kind of seeing it wrong for a long time. So now they took MRI scans of 40-year-old triathlete compared to a 70-year-old male triathlete. Look at that muscle tissue. That is healthy, good, awesome muscle tissue. But look what happens when you quit moving. It breaks down a lot faster. Okay, we got to keep moving. So if none of these things cause pain, and I have more list later on the things that we once believed that cause pain, but we actually know it does not. So what really does cause pain? It's a little complex. I'm going to make it simple though, okay? So in short, pain is your body's alarm system. It is your body's way of alarming you of danger. Here's the thing about pain. It is constantly learning. It's constantly learning. It is plastic. It is always learning what's bad, what's good. And this begins at a super young age. If you have kids, if you have nephews, nieces, whatever, grandchildren, I want you to watch at a certain age. It's usually around a later infant, early toddler, as they begin learning this. How often do you see a toddler kind of fall, hit something, do something bad? In the parent's eyes, it's bad, and that toddler's fine. However, the parent's reaction is as though that child is really in danger and hurt. And so what happens? The parent runs over the child. Are you okay? Are you okay? And where the child was okay, now he's freaked out. Maybe I'm not okay. And then starts crying, right? All because we increase the alarm system on that child. We help that child's alarm system learn that actually doing that is bad. Even though your body said it wasn't bad, it's bad. and we begin all of this kind of knowledge of what is bad on these kids, and sometimes good, sometimes inaccurate. Okay, as the alarm system is developing and the child touches hot things, it'll learn quickly that is bad, and next time they touch that thing or go close to it, they kind of think twice. Okay, I've seen this with my kids. Okay, as they get up under a table and they bonk their head pretty good, the next time they do that, but what do? They go like this. And even though they're like really far away from that tabletop, they're just making sure they don't do that again. The alarm system constantly learns what is bad, what is good. That's your pain system, okay? Here's one I've used on my patients as well. This kind of goes over not so well oftentimes when I say this to patients, but it's helpful. When I saw this, I was like, holy cow, that exactly nails pain. Pain is an opinion, not a fact. It is never a fact. It is always an opinion of what might be dangerous. Okay? I'll break it down more. So pain is your brain's opinion of perceived harm being done to the body. You guys, these are two super vague words. Opinion, perceived. Okay? Nothing in there is factual. It is your body's alarm system that has learned from childhood what is good, what is bad. Some accurate and some not so accurate. Okay? So I want to share an example of this exact thing. Okay? Lorimer Moseley, if you guys know if you've kind of looked into pain science at all, he is the lead. He's the top dog. In terms of my pain world, he's like Kobe Bryant, okay? So, yeah, all right. Which Kobe's the man. He's not Kobe Bryant. Let's use a different example. He's like just someone else, but no one touches Kobe. So Lorimer Moseley has this example, okay? And he says, I was walking in the woods one day, I noticed just kind of something brush on my leg. I thought nothing of it because in my past, I've learned from this exact feel that it's usually just a twig or something, or a branch, or a leaf, or just like something light and nothing. So what did the alarm system do? It did not get alarmed because it learned from the past that it's often nothing. This happens within like a millisecond, all this process, okay? So that night, he gets home, he looks at his leg, it's swollen, it's red, it's hurting. He goes to the hospital. It was a snake bite. A snake bit him, and he actually almost lost his leg. So kind of go past, a couple years later, he's in different woods again, but he's in the woods, and he's kind of walking along a trail, and he feels a brush on his leg. Now again, this happens within milliseconds. This brain learned a couple years ago, we were in almost the exact same situation. I felt the exact same thing. Last time we thought it was nothing, this time I think we're wrong. This time it must be a snake again. And so he felt real hot, crazy pain in his leg, just shoot right to his leg. And of course he looked down, there was a twig, right? So we can get it wrong a lot. All right, next story. This guy, I think this is in England, I think. He was on a job site, and as you can see, he got a nail in his foot. Somehow, he got a nail in his foot, okay? I don't know that part of the story. He's in pain. He's in a lot of pain. He's like, holy cow, this is painful. And he goes to the hospital. As he goes to the hospital, all the doctors, ER guys, they're all saying, I don't know what to do. If we pull it out, all the blood, all these things, I don't know. And so what they did is they cut around the shoe, the entire shoe, opened it up to have a good look, and the nail was right through his toes. Never touched any part of his skin. Never went through skin, never pierced skin, nothing. However, the guy was in intense pain because of the perception of danger. He perceived a lot of danger. However, there was no danger. His body was wrong. Okay, next. Can we impact our brain's opinion? So often these are kind of things in your own kind of body and your own alarm system. Can I impact other people's alarm system? Absolutely. I have a kid, he's 6. okay? Let's say that he's outside kind of playing, jumping around the street, on his bike, skateboard, whatever, and he falls. He lands on his knee, and there's blood on his knee. If you have kids, if you have ever been around kids, you know once they see blood, they think they are dying, okay? He comes into me crying because he has blood on his knee. And I said, now, as a parent, there are two ways I can handle this. Now, the way I always handle it is, oh, buddy, dude, I'm so sorry that you got hurt. I'm sure that's painful, but dude, let's wrap it up. I'll give you a big hug. You'll be okay, but everything's going to be fine, okay? So what happens to that kid? He kind of, okay, all right, Dad, thank you. And a couple minutes later, he's back playing again. The tissues on his knee are not healed. However, the pain is gone, all because I calmed down that kid's alarm system. I calmed it down completely to the point that he trusted that everything was okay in his knee. Let's give a different reaction, okay? Let's give a reaction where I say, oh my goodness, buddy, you scraped your knee. This is bad, dude. If we do not clean this up right now and the right way, we could get an infection. I need to check this thing out every night. You need to be really careful about this knee because we do not want to lose this leg. We could lose the leg eventually. If this thing gets infected, it gets worse and worse over time, we could lose your leg. Every night I want you in my room, I want to check on this thing every night to make sure it's healing well. When you walk, walk carefully. Do not run. For sure don't run, because if you run, you might injure your knee worse. Okay? Make sure no one touches this knee. This is bad, dude. This is bad. What did I do to my kid's alarm system? I raised it like crazy. We have learned that pain and alarm system are the same. When you raise fear and alarm in anyone's life, you raise pain, okay? So let's picture this kid for a second, okay? Every night, he comes into my room, Dad, how's it look? When he is asleep, if the covers kind of touch him wrong, whoa, get off me. If a dog walks by him, whoa, get away from my knee, right? If a kid comes by him, he's limping around the house because he has to walk carefully. He's in a lot of pain all the time because his alarm system is heightened like crazy, all because of me. All because I alarmed it like crazy. Now, I use this example on patients a lot, and then I say this line, and it sometimes works and goes over well, sometimes doesn't. I tell patients, example number 2 is the way that you have been treated, often by doctors and clinicians and PT, chiro, whatever. That is how people treat adults. You have herniation. Oh my gosh, you need to be careful. Do not lift, do not run, do not do this. You have this, you have scoliosis, you have these findings, you have this diagnosis. Be careful, otherwise you're going to make it worse. Otherwise this will happen and this will happen. And you might lose your legs and you might never walk again or end up in a wheelchair. I had a patient, kid you not, 2 days ago who was told, I'm not going to say by what brand of clinician, but by a healthcare person, if you keep on working, you will end up in a wheelchair. If you continue to move your body in short, you will end up in a wheelchair. So what did she do? She stopped working. Now she's on disability, right? Tissues heal. We know that tissues heal pretty fast. Our body's real efficient, okay? But the nervous system, our pain system, always remembers. It knows exactly what happened, what's going on at all times. It is learning what's bad and good, and it gets wrong sometimes. Wrong and also oversensitive, okay? As pain lingers longer, the relationship between tissue damage and pain really weakens. Because again, tissues heal, right? But pain can oftentimes increases based on that person's view of what's safe and not safe. Our alarm system, our pain system, our nervous system can become so overactive, so sensitive. I've seen a patient who cannot wear clothing on this patient. It was a shoulder. Has to always wear a tank top right here to make sure nothing touches that shoulder, because if even clothes touch her shoulder, it'll make it crazy burn in pain. because the alarm system is that sensitive, because her pain system has become so used to just always sending pain there, it just does no matter what. If there's wind, if there's too much wind, she's in pain. If there's a fly that lands on her, in pain, right? It becomes really, really bad, you guys. This is where we come into play, and this is really scary. The more authority you have in that person's mind, okay, if that person believes that you are the all-time just expert on that area, they will believe everything you say. If you tell them, oh my gosh, you're out of alignment, oh my gosh, this is awful, oh your tissues, oh your posture is really bad, blah, 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 all these things are bad, you need to do this and this and this and bad, overdiagnosis, what happens? That person believes it because that person's the expert, right? Our opinions matter. Our words matter, okay? So let's keep on going on the things that we tell our patients that we shouldn't. Okay, there's a lot of things we kind of do to kind of sound smart with our patients that we don't need to. We don't need to cause alarm on things that we don't need to cause alarm to, right? So I know we saw and we learned that MRIs do not accurately help us learn pain on a person, okay? But are they accurate at all? So check this out. So one person who actually has low back pain, right? She went to 10 MRI centers and she had 10 MRIs at different places within 3 weeks. And so 10 completely different people, radiologists, read these reports of the same person. 49 different issues, diagnoses were made. Not one of those diagnoses was found on all 10 reports. Not one. So that guy said something different, that guy different. Not one of all of these findings was the same on each report. Not one. So you're really just getting one guy's opinion, right? And so that's scary. Now this one, for non-trauma, this is a non-trauma. If you get an MRI for non-trauma, actually even with a little bit of trauma, your chances of recovery and your outcomes have already worsened. Why do you think that is? Because again, you're going to see all the aging, but no one's going to help you learn that it's okay, that all those things are super normal, right? And so the alarm system is raised. So another kind of one that we often teach as experts in our field, we have to be symmetrical. We have to be the same on both sides. We have to do everything the same on both sides. Otherwise, we're going to be off balance and we're going to be in pain. And that's going to not be fun to be in pain. And so what we're going to do is we have to make everything the exact same on both sides. So what would you say to a basketball player? What would you say to a baseball player? What would you say to a golfer who only swings on one side every time? Well, you have to swing right and left the same. Well, you have to shoot with your left hand and guys, it's ridiculous, okay? We do not need to be symmetrical. That's why I'm right-handed and you might be right-handed and left-handed and right. We're not symmetrical. We were never made to be. Do not let any person say, you're not symmetrical, you're not even, this side's higher, this side's lower, you need to be exactly. We don't need to be, okay? The body is what the body is. We do not need to raise alarm to things that don't matter. Another one, okay? 10% of our population has exactly equal limb length. But what do we see all the time from PTs, other fields? I'm not going to name them. They're constantly checking the hip size. They're making sure they're aligned, right? Because that can cause pain. And so what do? They raise the alarm that they're off when 90% of the world's population has uneven legs. You guys, that's super easy money on these guys. Super easy money because I know that person's legs are off. I'm going to use that. I don't think that they do it maliciously and greedy. I don't think they do that. But it's just an easy, well, let's just see if it's off. Oh, it is off. Let's just help and correct that, right? When we don't have to. That is not what pain is, okay? Now look at this lady. Her feet are way over pronated. Her knees are kind of knocking into each other. She is everything. She's a PT's worst nightmare. we would try to correct everything. We would move this after. We would kind of help the feet. I'll give her a lift. I'll give her all these things. But she's breaking records and she's not in pain. Right? Ribs don't go out of place. That's all I'm going to say about that. So stop putting them back in. Okay? They're not out of place. Just quit it. This one's interesting. So next, our joints, our bones, they don't mobilize, they don't move. Okay? I'll talk about manual therapy. I think it's soon, but just know that nothing is moving when you push them. Okay? Nothing is moving. We all know this. But when you crack your back or your finger, right, as you crack things, nothing is really being realigned. It's just some gas being released, right? But most people in the world believe, as their back is cracked, that something went back into place. And when you think that something's out of place, holy cow to your alarm system. It will go off. Okay? Let's avoid teaching that. The SI joint is not out of place ever. You guys, the amount of pressure that we can use to put the SI joint back in place is no more pressure than we do when we sit down. Can you imagine if we sat down every time we kind of just had our SI joint out of place? All because we sat down. Because we're placing more force when we sit down than we do with our hands when we're putting back up. So the math and logic isn't there, right? Yeah, and that's where I said that again. All right, IT band, I'll be quick on these because they're quick. IT band does not lengthen. Plantar fascia does not lengthen. I'm sorry, guys, unless you want to do a lot of force. General myofascia, all myofascia, does not lengthen unless you want to do a lot of force. So there are a lot of new clinics in town that do myofascial stretching. They're not changing myofascia. I can promise you that, you guys. It takes way too much force. All these things are not doing what you want them to do. In the olden days, we used to kind of think a lot of things were bad. Nowadays, let's lift, let's bend, let's move our body, right? So this is a big topic. So everything I just said really kind of hurts manual therapy. It really kind of puts a light on manual therapy as being worthless and pointless. I don't think it is, okay? From our very nature, as we were sad, as we were hurt, as we were bummed and depressed, what usually got us out of that? Touch, hug, right? Our mom's hug, our dad's hug, whatever, touch. That has always soothed us. And so what it is doing, what we are doing as we touch those parts of their pain, as we kind of move them, mobilize them, touch them, whatever, massage them, poke them with needles, right? Which I love doing. We're just calming down the alarm system. That's all we're doing. Alarm system in that area has been raised for lots of reasons. We are learning. All we're doing is just calming down the alarm system. Help your patients know that's all we're doing. I'm not correcting anything here. There's nothing about what I'm doing that is changing your anatomy. That is at all corrective. There's a source of your pain that me and you will find together. In the meantime, let's give you a little bit of relief. It's not fun to be in pain. Let's see what helps you get out of pain. Let's see what calms down the alarm system. Even if it's just a very short time, which we know it is. Massage on some people lasts for 10 minutes and then they're back in pain because their alarm system is so heightened that it's like, good try, buddy. Not gonna happen because I'm in the car and this is dangerous, because I'm walking down the street and something might follow me. I gotta be ready. I'm gonna send pain at all times, right? We gotta calm down the alarm system. We can do manual therapy, but we have to educate. We have to help them know there is something that keeps on triggering the alarm system in this area of your body. We gotta find out what it is. Stretching. This guy puts it bluntly. I don't think it's that bluntly. I think it's okay. His main point is if you move passively, if you kind of just passively stretch out, you're not really doing anything. All we're seeing, and they do not prevent injuries, all we're seeing is that your tolerance of discomfort in that move increases, which makes sense because the more that you do something, the more that your alarm system learns that this actually might be safe because he keeps on doing it and I'm not dying. So I think I'll let him do it. And so what happens is your alarm system, it becomes more tolerant of stretching, of whatever ends up being, if you do it enough times. And so kind of keep note of that, okay? As you do something more and more and more, alarm system becomes more trained that that's an okay thing to do. So maybe don't stretch all the time, but let's get those muscles built, okay? Let's get them going. Let's get them active. Let's get moving, okay? Posture. Posture is okay, you guys. Don't worry about your posture, okay? I don't think it's a wise choice to walk around like this, but when you sit down, when you sleep, don't worry so much about posture, okay? We are finding it is not correlated with pain, okay? Postures are okay, because you're going to see a lot of different shaped people in this life, and you're going to see people that walk like this. As you go up to that person and ask them if they're in pain, they'll probably say no. Or you see a person shaped like this and walking around, ask them if they're in pain, they're probably not. Posture doesn't matter because the body's adapted over time. It just adapts, okay? Desk job patients who have a lot of neck pain, back pain, all because they're trying desperately to maintain a posture that their doctors, that their PTs, that their whatever have told them that they have to sit in. These people are in way more pain than this person that sits like this. What happens when you try to sit like this? Your body's really smart. Want to know what it does when you're not thinking about it? It does this. And you're like, oh no, what am I doing? I need to sit up because I've been told to sit up, right? And then your body takes over because it's really smart and does this again. Oh no, what am I doing, right? Your body's really smart, we're not. Just go with it, okay? Postures do not lead to all these other bad things that people try to kind of just like point blame on. You guys, we really try to sound smart as we kind of blame people's bodies. If you're ever in a situation as a patient and your body is being blamed for your situation of pain, run, okay? So we know that kind of being like this, we've always kind of had this as a bad posture, but we see it in very normal, natural parts of our life. And so it just doesn't make sense. So how do you sit? Guys, go watch some kids sit down. Go watch some toddlers. Go watch people that have not been influenced by the just mediocrity of the world. Because we try so hard to be really smart and we try to make up all these things that are bad. But kids have not been impacted by that yet. And so they listen completely on their body. And they know that this feels good. I'm going to sit like this. I'm going to sit like this. Right? That's how we need to be. We need to just get comfortable. Okay? There's a saying, the next position is your best position. That's all that matters, because your body will tire of a certain position. Then move. Okay? It gets tired. Sleeping, same thing. Okay, don't tell people how to sleep. Don't tell them they have to be on their back. Don't tell them they have to be on their side. Don't tell them they have to be in one spot, because our body will take over. As your sleep, your subconscious says, finally, I can control this body. I'm going to move. I'm going to switch positions because it's more comfortable in this position. Finally, good. But then when the conscious is there, what am I doing on my side? I need to go on my back again because that's where I'm supposed to be. And that person then ends up in more pain because they don't sleep, and then they don't sleep, and that's more pain. It's a vicious cycle. Muscle stiffness does not equal pain. You guys, this is another one of those kind of badge of honors. Every day, I think Calvin would admit this too. Every day we have patients that say, see how tight that is? You see how tight that is? You see how tight? I'm in a lot of pain. Look how tight that is, right? No, sorry. Go look at an Iron Man. Go look at someone that muscle builds. He's a lot tighter than you. He's not in pain because we're toned, right? We're supposed to be tight-ish and move. My older patients, I like older patients. I love them actually because they really have lost hope. because they've been so educated so poorly over their lifetime that they are just rocked. They're just rocked by all the knowledge they have of their awful aging body, all the arthritis, all the degeneration, all the things, and they come into me to say, I'm just old. There's nothing you can do about it, Spence. I'm just old. Sorry. I'm just not going to get better. I'm just old. Right? There's no correlation between old and pain. Okay? I'm sorry. There's just not. So quit it. Don't rest your patients. Please don't rest them. Every tissue, I don't care how damaged it is, how broken it is. If they're on non-weight bearing, you can move other tissues. Keep on moving, okay? Rest is not helpful. Okay, there is some kind of tolerance of those tissues. You just have to find it. If you do too much, you'll end up in more pain. That's why people will rest. If you do too little, we get weaker and weaker and less tolerant on movement and activity, and it becomes harder to get out of that hole. So keep on moving in a place it can handle, right? Please don't rest your patients. Which also brings up this point, rice. You guys, even rice has been updated and changed. What the heck? Rice has been around forever. Now, we've gotten rid of rest and ice. Rest and ice are gone. Now it's just peace and love, which is weird. I think it's weird. But look at this. So protect it after, elevate. It still helps a little bit. Avoid anti-inflammatories. Avoid ice. Avoid icing. Compression's okay. Educate them. Help them know that, hey, this thing is going to heal. You'll be okay. Keep them positive, okay? Load them gradually. Keep optimistic, right? Keep active. Keep your blood moving. That actually makes things heal faster. It really does. And exercise within your limits of pain. Keep on moving. Do not quit. What we used to think the rehab and recovery after injury would be, or kind of getting out of pain, is just, if I keep on doing everything right, I'll be out of pain eventually. I'll be good. There'll be no setbacks. But this is that's rehab. Okay, you're going to just be all over the place. You're going to be in pain. You're going to have good days, bad days. You're going to mess up. We are human. We are not perfect. We are not going to do anything in this life exactly perfect. Even more so, how we use these amazing bodies, we're not going to do it perfectly. So our rehab will look imperfect. But as long as you keep on doing the right principles, you'll get there eventually. You will. How can you help the pain game? I made that up. Pain game. It's good. Just learning about pain, you guys. As you educate your patients on pain, that is more helpful than any kind of pain medication they can take. As they learn that, holy cow, my alarm system has really been raised. How much of a chance do we have? Not much. Because I want you to go back to the more authority that you have in that person's mind, the more that they can be educated, they can be taught, they can learn. We often have none. You guys, MDs have it all. MDs have all the authority. We are here and they are there. And this guy told me that my disc herniation and my arthritis and my degeneration and my rotator cuff tear and my meniscal tear, this is why I'm in pain. So sorry, Spencer. I'm sorry too. That's a bummer. But what if there's more? I began asking patients this in recent weeks. I said, without any of this spiel, right? I said, in the presence of all the things that you just mentioned, all the things that your MRI shows and your doctor has told you and diagnosed you with, do you think that it is possible to live a life without pain again? One person said yes. And I was like, good, I'm going to tell you why. Most people said no. And so I still educated them, but I was more tactful. Because everyone has to learn this, right? We have to. Pain control is not about turning off the pain. It is about working on ways to turn it down more and more. No one is invincible to pain, okay? I have a lot of patients that come back to me and say, yeah, I'm doing really well, but I still have pain sometimes. Yeah, you're alive, you're breathing, you move, you do things incorrectly. Your body is going to warn you a lot. So anything that we can do to help our patients change their kind of view of danger will change their pain. Again, Lorimer Moseley. He's the all-star. I'm telling you, he's the man. Your words matter. Guys, this is really sad. So people who are out of the toddler phase, so people that can learn and remember things, 90% of their beliefs of their bad back are from people like us, from doctors, PTs, chiros. That's where they get all these negative beliefs about their body, is us, because we like to diagnose, because we like to sound smart. And we like to give out a lot of fear because it makes them dependent on us. No, I don't know why people do it, but that's what we do to them. So try not to diagnose so much. If you diagnose, do with an asterisk. You know what? It seems like you do have a lot of disc bulging, you have a lot of meniscal tears, you have all the things. But the cool thing that we're seeing nowadays is that people without pain have these exact same findings. But there are ways that we can help you still. Most of them won't love that. Okay, most of them will be like, huh, what are you talking about? My doctor said that, You guys are going to try a lot of these things and you're going to fail and you're going to keep on trying and you're going to have people mad at you and you're going to say, I'm not trying to make you... Just keep on trying to help people, educate them, okay? And avoid overdiagnosing if you can. The most helpful pain reliever is helping the patient know and learn that they can do it, okay? Everything will be all right. Optimism, which I'm not a big fluffy guy. I've never believed in just roses and kind of cherry on tops, all these things, but there is something to it. There is something to a positive mindset against a negative mindset. A negative mindset, it just leads into kind of bad behaviors and bad feelings and bad intention, and then positive is opposite. It just is. As much as it sounds fluffy, which I don't like, it just is. Okay, quit getting and start doing. So people in pain, what do? They have to get the next great treatment for this pain. They have to get the Theragun. They have to get some kind of brace around their back and then they'll be healed. Or they have to get some pain medication, or they have to get an injection, they have to get a massage, they have to get all these things and then their pain will go away. We need to educate them. They have to start moving their body. Okay, they have to train the alarm system that moving is safe. What we see on social media is everything I just said. We need the traction, we need all these things, and that gets a lot of appeal. There's a lot of appeal behind all these gimmicks. Why? Because they're short. They're quick. It's a shortcut. It's a quick fix. It's an easy way to get me out of pain forever, because that's what they sell. They sell no pain forever. You guys, it's hard to live in a world that does this and be sane. Sometimes I lose my sanity because I just see all these things. I'm like, why are they doing this to us? And kind of at the same time, we've done it to our doctors. We've done it to them, because what do we do? If we're in pain, what do? We want to be out of pain like that. We don't want to learn what it is. We want to learn why we're in pain. We want to learn how to overcome it. Who cares about education? I'll get out of pain right now. So what do we do to the doctor? What is it? How can I get out of pain right now? It's this. Here's pain meds. Right? Because we train them. We have done this. I love this saying. This is also, I think, Lorimer Moseley. The goal of pain science is, of course, calm down the alarm system, but it's really to help them feel a lot safer to move. If we can help them feel a little bit safe to move, a little bit of, okay, I think it's okay to move, I like what you're saying, maybe I'll try this whole exercise thing, this whole movement thing, this whole activity, this whole life again. That's what it's for. That's what all of our kind of training and education on this is for, to help them move. So again, do not rest your patients. Help them modify, but do not eliminate. Resistance training has a huge effect on pain. Just like I've been saying, have you guys kind of been seeing these little trends? Moving good, now moving bad. Let's just keep it that simple. Miracle cure. 30 minutes of exercise a day. That's your miracle cure. Oh my gosh, I can't. Miracle cure. That's hard to say them both at the same time. Okay, that's going to help you the most. Low back pain recovery. So continuing activities within your pain limits. Again, we're getting redundant, right? Keep on moving, okay? Another big one. We can add to the alarm system while they're moving, while they're exercising. We can increase the alarm system. even though they're doing the right stuff. We can say, whoa, no, you're moving incorrectly. No, this is bad. You're not doing this right. You have to do this and this way, this way. You guys, do not do that to your patients. Help them learn how to move, but do not add to the alarm system of movement, okay? Because after they leave you, all they remember is all the things that they did wrong. I didn't move this right. And so when they're home and they're kind of picking up something, oh no, my PT said it, no, I have to, and their alarm system is heightened. Help them move, help them feel confident moving, but there's really no one way to move. Everyone's body is different, everyone's shape different. Just help them move, okay? Help them feel confident moving. Make it enjoyable, make it fun, okay? If they're doing a deadlift like this, you can correct it, right? Obviously, that's our job to help them move right, but we have to do it with an asterisk, okay? Do not add more fear and anxiety in their life, okay? This is cool too, you guys. This is something I've been helping patients see and learn, because a lot of people don't like exercising. I don't want to count my reps. I don't want to go to the gym and do this. I just want to go be active. I want to go play golf. I want to go and do tennis. I want to go in the pool. I want to go on hikes. I want to go and just like be with my grandkids. The general activity versus a directed kind of exercise program, no difference, you guys. Just get them doing things they love. Actually, it's more helpful to have them do the things they love than all the workouts. Why? Because they'll do them more. Because the more that you move consistently, the more that your alarm system learns, we're okay to move. This is fine. This is fine. Expectations, I could do a whole presentation just on expectations alone. You guys, there's some crazy placebo things out there that are nuts. If you ever just like want to enjoy a YouTube, always look up placebo effects. Our brain is crazy. You guys, it's in control of everything we do and feel and see and touch. Placebo is real. Help use that for them. Help them to know that everything's going to be okay. Expectations. Even if you think that they're not, just help them just like calm down the alarm system. Placebo is real. Sometimes our problem begins when you begin looking for one. How often do you see people, once they get hurt even a little bit, they wake up in pain, I have to know what it is. Oh, I'm sure it's my disc. I'm sure it's this. I better go to the MRI. I better go see my doctor. Oftentimes, these little pains that we get randomly, they go away randomly. Do not be alarmed by them, okay? Quit looking for problems. First rule of eliminating pain, do not expect it. I help my patients with this one a lot too. I tell them, I say, have no preconceived notions. None. And when you're about to go do something or want to do something, do not have any preconceived notions, which means do not say, oh, I'm sure that's bad for me. Oh, I'm sure that's good for me because it's a massage. I'm sure that's really good. Or that couch. Ooh, I'm sure that's not good for me. Or the row machine or the pool. No, that's way too much, way too fast. I tell them, no preconceived notions. If you want to do something, go try it. Go do it. And then see, sometimes you'd be amazed. The things that we have learned that are not good, like prolonged sitting, are actually really painful. And the things like moving and lifting weights and all these things actually make me in less pain. Holy cow. Who would have thought, right? It's crazy. So this is a good one too. So to a lot of people, as I teach them this, they will think this is mind over matter, that their job is to tune out the pain, is just act like it's not there, and okay, I can do that. I'll just move and I won't even like think about my pain. I'll just act like it's not. No, it's quite the opposite. Okay, do not ignore your pain. Okay, you have to be constantly in tune with your body and your pain because you need to retrain it. Because you have to help your body learn, whoa, no, this is okay, we're okay to do this, and then keep on doing those things that are safe. So I like to kind of picture a boss, because sometimes pain is our boss. It really is our boss. But are we in good terms with our boss, or do we hate our boss? Do we not want to listen to our boss, or are we kind of good buddies with our boss? Okay, because your pain really doesn't care what you think. Its only job is to keep you safe from all the things it has learned from your experience of what's bad and what's good. So what's going to happen with the boss? Okay, let's kind of picture this boss in this office setting. And there's this lady at a desk, and the boss is saying, oh, hey, I noticed you this morning. In essence, she woke up in pain. Hey, I noticed I wanted you to, oh, okay, yeah, hey, I need that report in. Oh, you do? Okay, I'll try. I need that report in. Days and weeks and months this goes on. You're still here you still want my report? I thought I did it, right? So what happens to that person? He's like, you keep on talking about the report. I don't know what even that means. What report are you talking about? So I'm going to kind of tune you out. And so we take pain medication. We do anything we can to kind of tune out the pain. I'm going to take some medication. I'm going to get an injection. I'm going to do whatever I can to get you to quit talking to me about whatever you're talking about, because I don't know what you're saying. So, oh, good. Okay. I'm going to put on headphones. And that's pain medication. It'll muffle the pain. It'll tune out the pain really well. That's its job. It'll tune out the pain. So now the boss is getting louder because he realized you put on headphones. I have to yell now to get your attention? All right, I'm going to yell. Oh, man, I can still hear the pain. I can still feel the pain even though I have all these pain medications. I better get more pain medication. I'm going to turn up the music in here. More pain medication, louder music. I cannot hear the boss. This is great. I don't care what he's saying because I can't even hear him. This is awesome. What happens when the pain meds wear off? The headphones begin to slowly come off. The boss gets really loud, really mad at us. And the pain's awful. So what do? We get more pain meds because we don't want to listen to it. So what would happen if we quit ignoring the boss? If we just stopped all the madness and said, what do you want, boss? We're going to have it. We're going to have it really good. Okay, when you go off pain meds, when you go off the things that kind of block your pain, get ready. You're going to feel pain for I don't know exactly how long, but I would be with a person that knows about pain when you do that kind of plan. Help kind of allow them to kind of help you in that phase. But as you kind of take off all the things that are making you ignore the pain, whether it's your own will, the pain meds, whatever it ends up being, as you just quit all that and say, okay, I'm going to listen to my pain. I'm going to see what it wants. What do you want, boss? As you start doing that, the boss will know that it has your attention. A boss that is yelling at you because they had to yell at you will begin over time to learn that, holy cow, I don't need to yell at this person because they're always listening to me. Even just doing that, you guys, the patient's pain intensity will begin going down. All because their pain, which in my mind really has its own life form, because it really does get louder if we ignore it, all these things, it really learns how to get your attention. If it knows it can get your attention with a whisper, that's what it'll do. My son is 4. When he is going potty and he needs me to wipe him, oftentimes he begins with a quiet, hey dad, I'm ready. If I'm somewhere else in the house or I can't really hear him, he gets louder and louder. Or sometimes I'm just like, oh, I don't want to go wipe him. So I'm going to kind of wait, for a little bit longer. I just want to kind of wait this out. But then he gets louder and louder and more constant, because he wants my attention. You guys, pain is the exact same way. Pain wants your attention. If we ignore it, it'll get worse and louder. Okay, do not ignore it. So the plasticity is what got you into this mess. Your alarm system learning what's bad and what's good has gotten you into this mess. The exact same system and program and adaptation will get you out of this mess. It'll begin to learn over time. And if you need help with this process, go see a PT who can help you with this process, who knows about pain, who really knows about pain, okay? This is a big one. If you ever go out into the world and begin teaching these things, do not be that PT or that person as the patient is saying, oh, my doctor said I have arthritis. Oh, no, that's nothing. Well, my doctor said I have a disc bulge. Oh, no, we've learned that's nothing. That's no big deal. You'll be fine. MRIs don't mean anything anymore. Don't be that guy, okay? Have empathy first. Listen to them. Help them know that you care. Okay, the person that just acts like they know it all, even if you're preaching the things that are true, if you just kind of come off as a person that just wants to be all kind of Mr. Know-it-all, then they'll know that. And a person in pain does not need someone else who knows all the answers, right? So care for them first. Listen to them. Help them know that you're on their side, that you want to help them in any way you can. And sometimes I will tell patients exactly that. I say, oh man, you've been in pain for a long time. I want to help you any way I can. I hope I can. I'm going to try my best to help you because that sounds miserable. And there's some things I've been learning about pain that I think can help you. And I start there. So Peter O'Sullivan, kind of the whiz in the world of PT, right? So any intervention that enhances a person's knowledge of their situation, empowers them to self-manage it, and encourages activities is a good intervention. Okay? So in conclusion, our goal is really to help people reduce the alarm system. Are you doing that? I hope you are.